Interventions with a King. Discussion and commentary based on articles from JACC, Cardiovascular Interventions.
I'm Spencer King from JACC Intervention, and I'm having a visit today with Dr. Olivier Bertrand from Laval University in Quebec City, Canada, about a paper he did, and Dr. Sunil Rao from Duke University. Olivier, you've done a very fascinating survey, quite ambitious, of all the operators in the world who are doing radial access. This is a tough job, but tell me what you learned about radial access from that survey.
Yes, thank you for the invitation, Dr. King. So the way we designed a 39-question questionnaire that was sent by the web, and we intended to get the feeling from around the world, from the different operators doing some practice of radial, so it was not focusing on the high volume operators, but try to understand what is exactly the current status of practice. And so in a couple of months we were surprised because we collected answers from more than 1,100 interventional cardiologists from around the world.
Wow.
Yes, and it was even more fascinating, from more than 75 countries, including countries like Afghanistan or Iraq, countries that we didn't even know or even suspect that there was an institution doing transradial approach. So that was the first message for us, that in fact it seems that radial approach is already performed around the world to different extents, as you may guess. And so we identified a couple of messages that was very important to us. And if I may say, the first one is that when we ask questions about the use of catheter, the use of needles, the practice, in fact, from diagnostic and PCI, and we were quite surprised to see that the myth that many physicians perhaps object to the practice of transradial approach, saying that they will need to learn new techniques or new catheters, in fact wasn't true, because for the left it was the Judkins catheter that was used for the diagnostic. For the angioplasty was the extra backup catheter. So in fact we realized that all the catheters that everybody has been using for years were exactly the same type of materials.
Did you get any clue about whether these people had been doing this a long time and exclusively, or did you have a reasonable population of people who had taken it up more recently and were getting used to it?
No, we could not answer that from the survey. We asked the questions. Basically, I mean, is it something that you do like 0 to 30% of the case, above 50%? And we were surprised that even in the US we get answers from very high volume operators, meaning more than 90% of diagnostic and PCI, and also very low volume operators, like less than 5%.
But I get the impression that all these people probably started with femoral approach. Did very many of these train and learn only on the radial approach?
It's a very good question. I don't think we can answer from the survey that we did with Sunil and a couple of good friends, but it's difficult to say. So most probably of those operators, because we also ask the range of age, and we go from 60 and above to 30 and above. So it's really like the overall range of the practice of PCI in the world, some way.
So you can teach an old dog a new trick. Is that what you're saying?
Exactly, especially because the tricks are not that complex.
I see. So when you're in there doing the case, you're telling me that you're doing it pretty much the way you did it femorally.
Oh, absolutely. I believe that once you are reaching the ascending aorta, the technique is absolutely similar to what you have been trained before. In fact, I converted to radial in one day when I arrived in Quebec City, and it's also the nursing aspect are very important. It's a team approach, and it's in fact the radial to me is a patient-centric attitude, and you all know why the benefit and why the world is turning its eye on the radial approach.
There's a great deal in this paper. It's going to come out soon in JACC Intervention, and I encourage everybody to look at it. But Sunil, why aren't we doing this in the U.S., and what's the story going to be here?
That's a great question, and I want to congratulate Olivier on all the work that he's done. I think that, Dr. King, you really underscored what the issue is it's really training. And mean, there's a lot of inertia, I think, professional inertia among the Americans with respect to the way they train. They like doing the same thing over and over again. Having said that, there has been an increase in the adoption of Transradial, and there's certainly been an increase in the attention being paid to Transradial. So I think that if we can meet the educational demands of the interventional community in the U.S., we probably will catch up to the world eventually.
Well, the two things we would like to accomplish with it, one, we know for sure we reduce the complications of bleeding, right? And number two, we may reduce the cost. We'll have to find out if same-day discharge is reasonable for us as well. Thank both of you for visiting with us, and we'll look forward to your paper in JACC Interventions.
Thank you very much.
Thank you.